Good afternoon. My name is Tony, and this is John Doe, and we'll be doing a head, ear, nose, and throat physical examination. We've already done our comprehensive health history, and this is our patient. What is your name?
John Doe.
Very good. Okay, so let's begin. So we're going to start off with the head, and I will be looking to make sure that the head is symmetrical. And I'm just going to kind of step around the back, and what I'm looking for is to see if there are any rashes, any lesions, any infestations, or any bumps, bruises, any abnormal findings, and there are not. I'm also looking to make sure that the face is symmetrical, the ears are also at the correct level, and there are no findings. There's no edema, no lesions, and no nodules. Very good. So now we will move on, and I would like to thank you for taking off your glasses and check the arteries, the temporal arteries over here. Okay. Palpating that area. Okay. Next, I'll be looking at all of your lymph nodes. So I'm going to start off over here, before the ear, the pre-auricular, the post-auricular in the back of the ear, moving down to the occipital, coming over to the tonsillar area, the submandibular, and the submantle. Okay, now I'm going to move down to the neck area, going to the anterior cervical chain, and then the post cervical chain, excuse me. The subclavicular. Okay. And there are no masses. The lymph nodes do move, and there's no tenderness to those areas. So now I want to check two cranial nerves. One is going to be having you clench your jaw, okay, and at the same time just opening your mouth and closing, okay, and there's no tenderness to that area. And the other is having you make some facial expressions. If you could look at the camera, and I'm gonna have you raise your eyebrows, yeah, and then we'll have you smile. You can see that's even. If you could frown, and if you could puff up your cheeks, and if you could pucker. Very good. So this test for cranial nerve number 7, and you can see he did that with ease. All right, the next I would like to check is your nose. Let me just get my scope. Did I leave it out? It's very warm. Okay, so we're gonna first look at the nose, and we're gonna show the camera that it is midline. Okay, so there is not shifted to one side or the other. And now I'm going to also look at the nostrils. If you could just look up for me. And I'm looking, and I see that there is some hair fibers there. There is no mucus. The septum is not eroded, and there are no lesions in there. No drainage coming from the nose. All right, I'd also like to have you close your eyes, and I'm going to have you smell this candle, and then you'll let me know what you smell. Okay, take an inhalation. What do you smell?
Sugar cookie.
He got that right. So that cranial nerve number 1 is intact. He did that with ease. I'm going to palpate the frontal, which is up here, and maxillary sinuses, and they are not tender, they are not swollen, so there are no issues with the sinuses. The next area I would like to move over to is the throat and the mouth. So if I can have you open your mouth. Okay, I'm looking in there at the color. I'm making sure that it's pink. There's no dry areas, no white patches. If you can stick your tongue out and say, ah, The uvula did go up. The tonsils are not touching. There's no streaking noted to that area. If you could just pull your gums down, your lips down so I can look at your gums. Great. And then up. The gums are also pink and intact. He has all of his teeth and they are not jagged or broken. Sorry, let me come on to the camera. The uvula we checked. We checked the tonsils. TMJ one more time. So this is just, again, opening your jaw and checking for, all right, there is a little bit of slight crepitus noted in the right jawline. So that is it tender on that side? Not tender. Very good. So I want you to stick your tongue out one more time, just to note that it is midline. If you could shake it back and forth for me, that's checking for the cranial nerve number 2, the hypoglossal cranial nerve. All right, now we'll move on to the neck. So I'm going to just first visually inspect, and I don't see what appears to be any goiter or pulsations, any abnormal findings on visual inspection. I'm going to sit so I could just be a little bit more level because of the height of the chair. Okay, so we can see here that the trachea is midline, and I'm gonna test from an anterior point of view. If you could just swallow for me. Okay, very good. And he was able to do that without there being any evidence of the thyroid being swollen. Also, I'm going to palpate the carotid arteries one side at a time so I don't have my patient pass out. All right, and I'm going to auscultate with the bell of my. So if the thyroid was inflamed, I would actually be able to hear a pulse in the carotid artery, which I should not be hearing any bruit. So that's what I'm checking for. If you could hold your breath when I say so. All right, go ahead and hold your breath. Okay, very good. There's no, you could breathe, no bruit present. I would like you to do some range of motion exercises so I can check. So I'm gonna have you look down and back, okay? And then I'm gonna have you come down one more time and go back a little bit further. This is hyperflexion. Okay, very good. And now bring your ear down to your shoulders on both sides. Very good. And then if you could look left and right over your shoulder as far as you are able to. And very good. The next thing I'm gonna do is have you push up, shrug your shoulders against resistance. Very strong. All right. Okay, so next we'll do the ear. Let this on again. So when I'm looking at the ear, of course, I'm gonna have you face the camera. And with the ear, I'm going to, of course, inspect the shape of the ear. And I'm doing that on both sides, just making sure that there's no abnormal findings. Also looking to see if there's any drainage. We do not want to see any blood coming out of the ear or clear fluid that could be from any kind of trauma. That could be spinal fluid, and there is no drainage noted, no lesions, nothing crusty, and no wax even coming out of the ears. So they are also both even with the eye, which is normal to be halfway down on the head. If there was some type of congenital birth defect, we would see those ears possibly at a different line. All right, so next I'm going to palpate and percuss over the mastoid to make sure that there's no mastoiditis, which first I'm going to look. So we could look behind the ears And if there was something like that, we would see some edema and swelling behind the ears. And I don't see that. There's some normal creases that is to be expected, and they are present. If it was swollen, I would not expect to see those creases. The inflammation would mask that. Okay. Let's see. So I also wanted to, I palpated over there for any tenderness. Okay. Nothing over there. I'm going to percuss on that area as well. All right. So mastoiditis would be if you had an inner ear infection and it did spread over to the bone, the mastoid bone, and you get this bone infection, and which is puts you at risk for possibly getting infection in your brain. So we have cleared him from that. I'm just gonna come on this side. I think, I'm not sure which way the camera can get me better. I have a couple more tests I would like to do, but I do need to turn you a little bit, I think, this way. Just try to get on this camera, keep my time down. I also want to press on the tragus for any kind of tenderness, and up on the pinna, pulling that back and around. No pain?
None.
That's good. All right, the next thing I want to do is get my tuning fork. I'm just gonna reach over you. Didn't think this one through when I switched sides. So what I'm gonna do is I'm going to have you, I'm gonna put this on your head, and you're gonna let me know which ear you can hear it more strongly in, or if it's even. Okay, this is the Weber test. Which ear do you hear it better in?
Both even.
Perfect. Okay. That's the Weber. I'm going to do the Renee test. Which I think this one is supposed to have. Okay, I'm going to put this over here. So let me know when you stop hearing that.
No.
Okay. And let me know when you stop hearing it.
No.
Okay. I'm going to do the same thing on the other side.
No. No.
Okay. And that is the Renee test. Okay. I need to use the otoscope. Okay. So now I'm going to look in there. Here we go, pull this up. There we go. Excellent. I see at 5 o'clock the white light. And now I'll come on this side. There we go. And at 7 o'clock I see the white light. I do see a little bit of scant wax in there. Just thinking to see if I forgot anything. No, that's it. Okay, we're done with ear. I am going to move on to the eye. Okay, so I do need to take the top off and just switch out my scope. And while I'm doing this, John Doe, I'm going to have you stand up because I have placed 20 feet away, just so you can see. a Snellen chart. So I'm going to go ahead over there. Okay. If I could have you read on this over here with both eyes with your glasses on from front to back.
DEFPOTEC.
Perfect. Now if you could just close your left eye. Yep, cover it. And read this line backwards where I'm pointing to.
CETOPFED.
Great. And now if you could cover the other eye. And what I'll do is just give you a second to let your eye come into. Okay, perfect.
DEFPOTEC.
All right, and that is perfect. So he can see at 20 feet, which is what most people can see at 20 feet. The next thing I need to do is to shine. I'm gonna have you take your glasses off. Okay, so I'm gonna shine the light in the eye. What I wanna do is see if I see a reflection in the same place in both eyes. All right, so if you could just kind of look off over my shoulder, that'd be great. Okay, it's in the same spot in both eyes. The next thing I'll also have you do is just close your eyes for a second, and on the count of 3, open them wide. 1, 2, 3, open wide. And I'm looking to see if, very good, if the light I'm shining the eye in constricts as well as the opposite eye. And I'll do that now on the other side. Close your eyes tightly, and on the count of 3. 1, 2, 3, open. Great. Oh, I wasn't supposed to shine it back in there. Let me just do one more time. Close it, open. It's cheating, I was doing it for you. All right, now the next thing I want you to do is to focus on something way off in the distance, the Snellen chart perhaps. And then I'm going to have you look at this pen light and keep looking. It's gonna go to your nose. Okay, and his pupils do constrict. So their pupils are equal, round, reactive to light, and accommodate. The next thing I would like to do with the eyes is, there is something else I would like to do with eyes. The cardinal gazes. I'm gonna have you, with the pen light, do not move your head, just the eyes. Up, over, and this is checking the cranial nerve, seeing how your ocular motor is. Okay, he did that with ease. So that cranial nerve is intact. Okay, I think it's time that we now look in your eye. So I'm going to dim the lights. I hope the video can still catch this.
Yes.
Okay, I have my ophthalmoscope on 0. I'll take my glasses off, and I'm going to be coming in. So I'm going to have you look also off at that Snellen chart and just keep looking there. And I'm going to hold your eye open. Okay. Okay, I see the red reflex. And I'm looking for, okay, I'm coming to the other side. Yeah, the Koptic disc. I'm looking also for the optic disc, the arterioles, the veins, and the macula. I am having difficulty, and I think if I had been able to dilate his eyes, I could see more. But I can definitely see the red reflex. Oh, I can see more on this side. Okay. think this concludes. Just making sure I didn't have to add anything else. Yes, there is. I wanted to make sure that I'm looking at your, pop the lights back on, the eyelashes and the eyebrows, making sure there's no discharge coming out of any drainage from your eyes. I'm gonna have you hold your eyelids down so I can look at the color and then have you hold them up. Okay, so the whites of the eyes are indeed white, the sclera is white, and there is no abnormal findings in the eye. And that is it. This concludes my head, ears, nose, and throat physical examination.